Hi everyone. Good morning. This is Ramatu Muhammad with Center for Leadership in Disability at Georgia State University. I'm also the Grassroot connector for non-emergency medical transport, sponsored by Georgians for Healthy Future and the ACT Georgia. Today's webinar is on non-emergency medical transportation. Before we start the webinar, everybody apart from me is muted, and you could feel free along the line if you have any questions during the presentation for you to type it in the question bar, and we'll get to it at the end of the webinar. So I know a lot's happening in town with the coronavirus and people all working from home. So I am actually doing this presentation from my house. And due to this, my co-presenter, Elizabeth Snari, have to watch her son, may not be able to join this webinar. So I'm going to go ahead and present. I didn't want to fail you guys. So here we go. Georgians in the driver's seat, a grassroots approach to reducing transportation-related barriers to care for Georgians covered by Medicaid. So what is non-emergency medical transport? Non-emergency medical transportation is a required Medicaid benefit that provides transportation to and from healthcare appointments that are for non-medical emergencies. Yes, here goes the van. So what is considered a non-medical emergency, sorry. So this includes regular doctor's appointments, going to hospitals for body scans or other types of investigations that are hospital related, going for therapies, because we know our population with disabilities would need to go either for occupational therapy or speech therapy or physical therapy. Even going to the pharmacy to pick up your prescription is considered a non-medical emergency. And then also going for dialysis visits for those that have renal failure. So why is non-emergency medical transport important? Non-emergency medical transport is a benefit to the health of low-income people, as well as individuals with intellectual and developmental disabilities. Let's look at the data. Why is this important? What are the facts? So about 1.4 population, 1.4 million population currently have Medicaid. That is about 28% of that population are currently using non-emergency medical transport services. Total trips to the office is about 3.7 million. Additional data, let us break it down. We have 5 regions. We have the Central, the East, the Southwest, the North, and then the Atlanta region. This consists of 158 counties, with Central having 26 counties, the East part of Atlanta having 47 counties, Southwest having 48 counties, and the North 34, while Atlanta has 3 counties. Who are the brokers for the non-emergency medical transportation? We have Logisticare and we have Southeast Trans as the 2 brokers that run this non-emergency medical transport. 396,659 are the numbers of unduplicated riders. That averages 9.38 of trips per rider. So what are the threats to this non-emergency medical transportation? The Centers for Medicare and Medicaid Services has indicated that they will propose a regulation. And the proposed regulation is to allow non-emergency medical transport to be an optional state medical benefit. And states could amend their state plan and regulations to eliminate the benefits. So we need to encourage our population to utilize this very essential service so that we could avoid all these threats that are about to affect the non-emergency medical transport. What is next? What can I do? Advocacy is one thing that one can do to help keep this service, because it's a very well needed service in the community. So talk to people around, let them know that this option is available to the community. You could also contact your legislator to make sure that these threats don't happen, like we don't get the cuts or the flexibility of the funding being reduced towards non-emergency medical transportation. Then you could also participate in an advocacy day at the Capitol, and this could be found in the calendar. You could also write letter. We have several samples. If you send emails, we could send you a sample of a letter that you could modify with your information and send to a legislator. Then another thing we can do is to train, lift up your voice. We should train people around about the importance. This is one of the medium. We're trying to educate the population about this essential offer by Medicaid, which is very important because most of our disability population do not have the means to take themselves for services, and some of them don't realize that this is an option for them. So you should find a training around your state and attend to just get more information about non-emergency medical transport. Inform others about the training if you find out that there's a training going on, and then you can also host your own community event. How do you find legislators? These are other ways that you could do it. You can visit the openstates.org to find who is your legislator for your address. If you put in your address, you type in your address with your zip code, and then you'll find out information. Advocacy Days at the Capitol. So this is a typical agenda or schedule for an advocacy day. There's usually an arrival time, and there's like a wait room where across the street from the Capitol where people wait, and then registration happens, and then there's a breakfast is served, and then advocacy day orientation happens, and then people can now walk over to the Gold Dome and visit with their legislators at the ropes. How to find state legislators and non-emergency medical transport broker? You could click either the state legislatures or go to the NEMT broker site. How to find your representatives? This time around, you will visit the website called visithouse.gov, and then type in your zip code, and then you could find out who your legislators are. And then this is the step where just elaborate how to find your NEMT brokers. I had mentioned earlier that there are 2 NEMT brokers in Georgia. There's the Logistic Care and there's the Southeast Trans. For how to find them, you could go to medicaid.georgia.gov, and then you can find information. Select programs, and then go to all programs, and then you go to non-emergency medical transportation tab, and then the list of brokers would be at the bottom of the page. We would like to send you a survey at the end of the webinar for all those that have attended, for us to know if you've gained much from this presentation. We need your help. We need to hear from you, and you could contact, if you want a story or wish to share, you could contact Alisa Green with Georgians for a Healthy Future. Help spread the word. If you're interested in learning more or wish to host your community event, please contact Elizabeth Snary with the ACT Georgia. Let's work together to make a difference. Thank you for listening. This has been a short webinar. I want to look at the question tab now to see if anyone had any questions to ask. So you can send in. I know it's been a very straightforward, easy to understand webinar, but we need to get the information out because people are not using this service, and because they are not using this service, there's a threat of it being, the funding towards it being reduced or modified by states and federal government. So please, if you have anything to add, anything to say, or you could also send me an email or send Elizabeth Snally. My email is rmuhammad, that is MUHAMMAD14 @gsu.edu, or you could also email that's Elizabeth Snaries. So her email is snarey@theac Georgia. Feel free to reach out to us with any questions or concerns. So with the absence of any questions coming in, I would have to end this webinar now. Thank you so much. Please stay safe in this times of coronavirus in town. Please keep yourself and your family and your loved ones safe. Okay, yes, someone just had a question pop in. Let me see what's about, okay. So this question says, in addition to non-emergency medical transportation, what about transport for everyday average situations? So the thing with Medicaid is that there are criteria for what qualifies for non-emergency medical transport. So the transport has to be medical related. That means it was either prescribed by the doctor, like going to the pharmacy to pick up medication, or going for therapies, or going for regular doctor's visit. So for now, the NEMT does not cover average, everyday situations. It covers medically related non-emergency situations. I hope I have answered your question. Okay, another one came in. Do clients contact Logisticare or Southeast Trans directly, or need to call Medicaid? So you contact them directly. They have contact numbers. When you follow the prompts that I had earlier mentioned, and it takes you to the two brokers, they have contact numbers, and you contact them, and one of the things they would ask you is the Medicaid number and the reason for the visit and where the destination is. I am aware right now that apart from using the regular type of vans, one could use Lyft. So they actually would organize, they have an agreement or relationship with Lyft through these brokers. So the brokers are the contact people. You contact them first, and then they would call whatever transport you prefer. They could send you their own car, or they could send Lyft to come and pick you up. Someone asked a question, will you be sending out a copy of this presentation? Yes. All our presentations for the parent series or disability related topic series are usually archived. So after the presentation, I'm recording it right now. I'm going to transcribe it and save it on YouTube. And then after that, I would create a YouTube link through the GADSEC consortium, that is the Georgia Inclusive Post-Secondary Education Consortium. I'll put it up and update it there. And anybody that participated or even registered but did not participate, we plan on sending you a link so that you could access both the PowerPoint and also the recording of this webinar, so that if you want to go back and see what did she even say in that question that was asked, you would hear what I have recorded. It says, do the brokers work specific areas of the state? So yes, they do. Depending on when you call them and they ask you for the information, they will tell you how they usually manage your area, depending on your address. But what I'm sure is that they do liaise with Lyft because of the need. Some of them don't have enough vehicles, because in the past there has been issues about waiting for vehicles to come pick people up. That is why they now liaise with Lyft. And part of the rules is they need you to call them at least 3 days before your stated appointment, to tell them that on so date I need, and so time I will need ride to the pharmacy, or I will need ride to the doctor's clinic, or I will need ride for occupational therapy or for speech therapy. So when you tell them that, and then on the day, usually you would call them early to just make sure that everything is in place and you're set and scheduled to be picked up. Very, very good questions. Thank you so much for all these questions. Very, very informative. I'm so happy, informative. I'm very happy that we're getting to discuss this. Any more questions or concerns or need area of clarity? I am here for you guys. So as I said, following the presentation, you need to follow all the prompts. You have to go to Medicaid site first and then follow the prompts, programs, then all programs, then NEMT. That's the tabs you keep tabbing. Medicaid website, you go to programs, then you choose the option that says all programs, then you go down to the option of the tab that says non-emergency medical transport. When you touch that tab, then it takes you to the brokers, and then there you would have the contact information of the brokers. So not to keep everyone online, if you have any more questions, I am waiting a little bit more, maybe 1 more minute. And if I don't get another question, then we would have to end the webinar, but feel free to send me an email if you need any more clarification or any questions to be addressed. And don't forget, you are going to receive a link. You are going to receive a link with the presentation, the recording of the presentation, and also the PowerPoint slides for this presentation. So someone just asked, can you just Google the brokers and call them directly? I think they may be available on Google. I never tried it that way, but it's an option because you have their name. Just in case you don't remember the name, then you could follow that route and find them, but they're called Logisticare and the other one that is the Trans. So I think you can try it. If it comes up, call them, but I know they would need to have your Medicaid number and your address. Those are the 2 essential things they need. Probably date of birth, name of client that needs the service, and the parents can use it for their children. Self-advocates, people living with disabilities could use it. There's no limit to how many times you could call them. The only thing is you need to give them a heads up. At least 3 days before the appointment, call them and let them know you will need this service. Then also a reminder call. That's what I know people that have used it. You do that. You call again in the morning just to make sure that you're all set and they have everything straight up for you. I think that's it. Yeah, you could do that. And but I will try it after the presentation. I will Google the brokers and see if something comes up, but it may possibly come up because they're a company. Yes, so thank you so much. I hope I have answered all your questions. My email once again is rmuhammad@gsu, rmuhammad14, that's 14, the number 14, @gsu.edu, or you could reach out to Elizabeth Snarey on SNAREY at the ARC, Georgia. Thank you for listening, and do have a pleasant day and stay safe.